Hi, my name is Stephanie Woodrow, and I'm a nurse practitioner student at Auburn University, and this is my 5-minute video on Parkinson's disease. Parkinson's is a neurodegenerative, chronic, progressive disease that is primarily idiopathic in nature, and what happens is there is a depletion of the store of dopamine in the brain, and this greatly affects movement and balance. And again, it's degenerative and progressive. There's no cure for Parkinson's, and there's also not one single diagnostic for Parkinson's, but rather it's a compilation of an extensive H&P and the symptoms that are seen in practice. The diagnosis is made through a criteria that basically is supportive and exclusive. And this is oftentimes made with a neurologist or by a neurologist. The risk factors for Parkinson's include age, gender, and exposure history. The average age for diagnosis is 60 years, but many people are diagnosed between the age of 45 and 65. It does affect men more than women, and there is a link to a possible history of exposure to pesticides, herbicides, and toxins, as well as ingestion of certain medications. 3 essential questions to ask during the workup of Parkinson's include, have you noticed any shaking in your fingers, hands, arms, feet, or legs? Have you noticed slower movements when attempting to stand, walk, or talk? And have you noticed increased stiffness in your joints upon movement? The rationale for each of these questions is simply because Parkinsonism is one of the first things, or at least a collection of symptoms that you see with these patients that are characteristic of the diagnosis. 3 physical exam components that are important to consider are neurological and motor. Common primary and secondary motor symptoms or assessment findings include bradykinesia, rigidity or stiffness. This is caused because of a resistance of the major joints to passive movement, and it's often referred to as cogwheel rigidity. Resting tremors, which can increase during times of emotional stress. Dysphagia, hypophonia, excessive salivation, frozen shuffling gait, an expressionless face, which is also called masking. There's some non-motor symptoms that are oftentimes seen before the motor symptoms are reported, and these are found in the GI and GU systems. So constipation, urinary distension, or bladder distension, frequent UTIs, incontinence, reflux, and erectile dysfunction. The third system is psychological. This is important because many caregivers usually will report a change in behavior or mood. So common symptoms found with Parkinson's are apathy, hallucinations, anxiety, depression, early signs of dementia, obsessive compulsive disorder, and impulsivity. The components of treatment for Parkinson's include pharmacological, non-pharmacological, and some invasive treatments. Pharmacological is geared at the drugs that are targeting the symptoms seen with Parkinson's. Non-pharmacological would include intense physical therapy, speech therapy, and cognitive therapy. And these therapies are also aiming their treatment plan at targeting these symptoms, but they're also geared toward reducing the risk of injury associated with the symptoms found with Parkinson's. The invasive procedure, it's stimulation and ablative treatments. These treatments are not recommended for patients that are already showing signs of psychological and cognitive change. The other point or thing to point out is that it could take 3 to 6 months post-procedure to know if the therapy is effective. 3 priority teaching components for Parkinson's include compliance to the treatment plan, understanding of the disease, mostly that it's progressive in nature and that we're managing symptoms and preventing injury, not curing the disease, as well as safety teaching. The safety education should also include a home safety evaluation and possibly accommodations to make the environment safer for the patients. And that is the end of the presentation. Thank you.